All right, joining us now, Laurie Garrett, health policy analyst, Pulitzer Prize-winning journalist, columnist at Foreign Policy magazine. She's been my guru for this from the absolute beginning. Laurie, you published an article today, and I want to quote from it. In October, when the United States was seeing 50,000 new cases per day, the cautious Institute for Health Metrics and Evaluation at the University of Washington predicted that by around Inauguration Day, deaths could reach 2,200 daily with a cumulative total of 386,000. But since that October 22nd announcement, the daily infection total has more than doubled and deaths have risen to more than 1,100 per day. If these trends go unfettered for more than 70 days, the United States official death tally could top 400,000 around Christmas, and deaths might exceed 2,500 a day. Hospital wards across the country will be full. And I've learned from you, Laurie, not to underestimate what you say. You are not an alarmist. Everything you've said that'll happen has happened. Are you actually worried that this is where we are headed?
Absolutely, Ali. And what makes it bone-chilling for me is recognition that we still have 71 days of the Trump administration, and they show no inclination to do anything that could slow this train wreck down. And we're looking at states all across America that already have full hospitals, already have exceeded their healthcare worker personnel. You know, the thing that's interesting to think about is when you and I first started having these conversations, New York was the epicenter, and we had a unique situation here in the tri-state area of the East Coast of the United States. We got through it, a horrible nightmare, but we got through it because doctors and nurses came from all over the country to help us. Today, what we're in is a situation out of control in at least 43 states. Almost every place in the country, every county is showing an increase in this disease. Nobody can spare healthcare workers. Nobody can spare supplies. Nobody can spare hospital beds. And I hate to say this because I don't want to sound ghoulish, but we're approaching the point where no one will be able to spare morgue personnel and coroners.
That was the whole issue about the curve. I want to read again from your article today about the vaccine. Let's be clear about what this Pfizer study shows so far. For 90% of the volunteers who got the vaccine as opposed to the placebo, the infection did not occur for a study period of 7 days. Nothing more is known. If that protection turns out to be durable for, say, a full year, the Pfizer vaccine might be deemed a spectacular success. But nobody's going to wait a year to find out. What's the implication of that?
The implication is whether it's this vaccine, the Pfizer product, the next one up, waiting to get up at bat, the Moderna vaccine, or any of a number of others, we're rushing them through and we're going into widespread use with very, very short-term data. Now, good news with this one is there's no evidence of side effects. So at least we could probably say it won't hurt anybody. But will it provide protection that really keeps you from getting infected with the coronavirus for the next year or 5 years, or best yet, the rest of your life? We have no idea.